Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning,
Good morning.
everybody.
Jim, good morning.
We asked Jim to stay because he's so interested in everything Dr. Mencia says
And we have
does.
beautiful Ina.
Oh, yeah.
Let's go over here.
Yeah.
With her smile.
Yeah, well, Ina's
She doesn't
wonderful.
talk until after the show.
No.
Then she goes,
Before and after.
before and after.
No, but Dr. Mencia, it was very appropriate that you mentioned Ina in a sense because you can't be everything at the office. You know, you're the medical doctor. You're the medical doctor. And you have to, and you're very good about always being on time, and you get to see someone, even if it's for 5-10 minutes, because you have so many fantastic assistants. And I have to compliment Ina here because when I need something, I'm not going to call you directly. I'm going to call
It
Ina.
won't get done.
I'm
You
gonna,
have to call
no,
Ina.
you're too busy, but I'll call Ina, and it always gets done.
It
She
gets
makes
done.
sure that it's done. So put yourself in what Jim was talking about. Who is going to take care of that person at home? Now, you brought up a very good point in the last time. That's all right. You send someone home. Here's your prescription. Take care of it, right?
Exactly.
And what happens?
And then what happened? They come back and they are feeling worse than when they saw me. And then you are concerned, like, wow, am I a bad doctor? What happened here? Did I do the right thing? Did I give the wrong antibiotic? Or was the walker not appropriate? What? And the patient either fell again or the simple infection have become a overwhelming infection. And they just say, well, I'm sorry, I didn't have time to stop by and pick up the prescription that you gave me.
And
So,
you're the
you know,
doctor. You
you're
can't
the doctor,
follow
and the
them up
and the
every-
problem is not the patient. I never blame the patient. You know, a lot of times when you see the patient, the easy way out for doctor, guess what it is? Non-compliance. They say the patient is non-compliance. That way the doctor is covered. Because now,
I didn't
if I
even
give
know
you a
that.
prescription and you didn't carry through, then you become a non-compliance patient. If anything happened to you, now the doctor is protected. But that is not the answer. Sometimes when I serve as an expert witness in cases, well, non-compliance doesn't necessarily mean that the patient didn't want the prescription. Did you ask the patient, or do you have a way to get the script? And that's why, with Jim Company, with Senior Helping Senior, you have that personal assistant coming at you whenever you need it, and for as long as you need it, it's there.
So,
And-
Dr. Mencia, when you have a patient and does the assistant, let's say they have a caregiver with them, do you let them come in and be a personal
Absolutely,
assistant?
yes. When the patient want to talk privately, I get the assistant out. I say, okay, the personal assistant, you can sit in the waiting room, stay outside. Then I bring them back at the end in front of the patient and let them know what we have discussed, that it's okay with the patient for me to expose to the personal assistant. Because some people think, and some company, that just do caregiver. They don't do everything that Senior Helping Senior is doing, because what they are doing is cutting edge on helping patients, seniors. What they are doing is they are putting together all those fragmented services that are out there into one bundle, into a restaurant menu, where the patient can take and say, well, what kind of personal assistant do I need? And for how long? They are opening that up to the patient, where if you go to a companion service, the companion sometimes is too much of a companion. You get no privacy. Mm-hmm. If I can go to the bathroom and do number one by myself, I don't need you there. If I need you for number two, I'll call you. And they want to stand by you. And imagine you going to the bathroom to do number one.
That's very interesting.
If you're going to eat your food, don't shove it up my mouth. Let me tell you, how do you eat your breakfast? How do you, Jim, eat your breakfast?
Wow.
We all have our own little style. Mm-hmm. Some people like to cut the egg, take a little piece of bread. You do what you do. Don't change my life. That's what people, get confused and say, they want to take over your life. That's not what we need. We need people to help out. And, and talking about like Ina and the supporting staff. Yesterday I had a doctor that developed a rash. And when he called and he said, I have this rash and I couldn't sleep at all. And it was all over the body. I said, well, over the phone, I'm trying to diagnose the patient. And I said, well, did you started any new medication? Did you buy new shampoo? Did you have new detergent? And we are going through that. No. Okay, you need to set up an appointment. So he said, can you give me the phone number of somebody? But I have a schedule full of patients. I said, okay, you know what? I'll call you back.
This is a doctor.
This is a doctor.
When you said doctor, I said, I think he said the wrong word. I thought he meant patient.
No, a doctor who is a patient. So I said,
Doctor's a patient.
you go ahead and do what you have to do. I'll call you back. Just tell your secretary when I call to put you through. He said, okay. So I have Patricia sit down. And I say, I need an allergist. I need a dermatologist. And I need to schedule the appointment for today and in the afternoon so that the doctor can go ahead and rearrange the patient and go and get taken care of because a long weekend. This was yesterday.
Yeah.
So Patricia became the personal assistant in that case. She got on the phone. She started making phone call. Okay, who's available? We got an allergy that is 2 or 3 buildings east from me. But they are not there. But they are in Boca. I say, perfect. East Boca, we'll get that appointment, set that up. So she said the whole thing. When we called the doctor back, okay, you have an appointment at 2 o'clock, I think it was, with the dermatologist, and a few blocks away, you're going to go to the other appointment and you have the allergy. Everything is set up for you.
Nobody does that.
And, then you put yourself, you and Bill. Bill has an appointment. You still have a life full of business. You're still running your business. You are very active in society. When Bill has an appointment, it's going to take time from you to set up all of those segments to get him to his appointment. That most of the time, people like you and I will say, you know what, I'll do it myself. I'm just going to take Bill for that appointment and do what we have to do because we don't have a service like Senior Helping Senior that will one phone call and say, this is what I need. What we did yesterday with that doctor. We'll call you back, and how does that work for you?
Take care of it, and on the way home, go to the grocery store because I can't get there, and this is the stuff I need, right?
Absolutely.
Can I do that? Oh, this is personal assistance. I think you got to change your name.
We got to change it to, yeah.
It's a
And,
you can use it, too. Who's doing your underwear?
I do it myself.
See?
I was saying, I was telling Jim, when I pull out my shirt out, every night I pull out my shirt, my tie, match everything with my, the socks and my underwear, my undershirt. And usually the first button of the shirt, I already have it tied down on the sleeve. So that when I put it on, I just have to do the last button and off we go. So when that button, I forget to do that button, I say, that dog and my butler, didn't show up.
But you bring up a very good point. Now that we hear about Donald Trump so much, I was thinking about it that I'm sure he has a butler. I'm sure he has chauffeur. I'm sure he has someone that fixes his food when his wife's shopping at Tiffany or whatever is happening.
And certainly has a hairdresser.
Yeah, by the
certainly has somebody
I'm
doing
sure
his
they
hair.
all have. But think about it. The very wealthy, and I've said this before, when people say that it's making them, they want to keep their independence. Well, very wealthy people, they have all these people. It's not that they're not independent.
Yeah, a lot of people can be wealthy. A lot of people can have plenty of money, but be unsuccessful. And a lot of people can have a lot of money and be successful. And the people with the wealth and the success is because they know how to utilize the services around them. And, when it comes to seniors, a lot of time our pride and our lack of knowledge and the lack of resources, you're talking about writing an article, lack of resources of what's out there that I can utilize that won't take over my life. People think that Medicare is something that that you pay for, you earn Medicare. You earn it. It's not a given to you. It's nothing free. The country is not giving you something free. When from the day we started working, all the way through until you retire, you've been paying taxes, and some of that money go to pay for your Medicare. So you earn that money. That's your money. And, it's okay if that money will buy you a walker. Put it in the closet when you don't need it. But you have it there. It's yours. And when you feel very unsteady, how many times you and I, we get up in the morning, Jim, you still young, you get up in the morning and your back is killing you. And you go, oh, my God, you take a little time, you open the hot water, you let it run on your back. And senior, it would just happen to last longer and affect their quality of life deeper than a younger person. But it's always there, just part of life. So the younger person would not need a walker because they hold on to the wall for a little bit and they exercise and they will shake it off and move on.
I'm glad you brought that point up. And I know that there are people who have walkers, and I'll see them without the walker. I'll say, why aren't you using your walker? Well, I don't need the walker. And I'll say, you don't need it until you fall, because they're either embarrassed or, they're just being so foolish. Mm-hmm. But then society does look at them in a different way. And that's what we have to do, too. We have to change the person's...
Exactly, the perception.
Exactly.
The perception. Because, even I had a young guy that had a knee replacement, and I see him walking without the cane and without the walker. A young guy in his probably late 30s, early 40s. And I say, Gary, you are a brave man. You already have no walker. I say, oh, my God, my knee is killing me. But I say, no, you're going to damage your other knee now. Use the cane, use something. He said, no, it was foolish of me. I just didn't want to walk around with that stuff. I'm too young for it. But you just got your knee. You are too young, but you need it right now. And that's what seniors need to understand. That the pride that they have when they see a walker, having a companion, having a personal assistant, quote unquote, it doesn't mean that this is for the rest of your life. It's not written on stone. It's not, a contract until you die. It's until you need it. The moment you say, I don't need this no more, then, okay, sign off.
Dr. Mencia, I bet that you see people, women especially, come into your, for their appointment, and they look beautiful. They have their hair coiffed.
Yes.
That's an important thing, because they will take a day to be able to come see you so they look beautiful.
Yes.
And that's so important for them. And I'm sure that knowing you compliment them and you tell them how beautiful they look. And that's something that we have to remember, that having an assistant, personal assistant, help them get up in the morning, gets to the beauty salon, they get dressed, they don't stay in their pajamas all day watching television. That's really what we're talking about, aren't we?
I have a few patients that they are ex-models, retired, or ballerina, and they will make sure they get their hair done before their appointment. And they come so impeccable to the appointment. It's beautiful.
But that's part of medicine, I think.
Absolutely, because you have to treat the body and the mind. You have to sometimes even get to the soul of the person. And when we are treating the patient, the problem with medicine, a lot of primary care physicians that are no geriatrician or no pediatrician, because pediatrician, they also have to have the biopsychosocial component of treating kids. And geriatric medicine is on the other side of the spectrum. But we have to understand the patient. I had a husband and wife, Jim. The wife decided to see me as a patient. So we go through the routine. Tell me your past medical history. Tell me the surgery you have had, what medication you are taking. And when we went through the social history, do you smoke? I say, oh, no, I never smoke. Do you drink? I say, yeah, I drink, but I've been drinking a lot lately. I say, well, when did that start? He said, well, my husband got diagnosed with Alzheimer's. I began drinking a lot. So she's letting out the stress, the frustration. So I went and got one of the magazines. I didn't know you were going to be here today. I gave her one of the magazines. I said, call this company because you need help. Until you get help, we can deal with the alcohol issue. But we need to take care of you and your husband because you love your husband. And you will not change what you are doing because of the attachment between you two. So let me get somebody in there. And a lot of times, thank God to the magazine. So that's why, I'm always going crazy when the magazine is not in my office. I will go, Ina, what's the magazine?
No, thank you. I'm glad to know that. But so you're saying, let's just go back to this. So that woman who now is so frustrated, if she had a personal assistant or someone, what would she be doing with them?
It free her some. It give her some freedom because this person that she loved for all these years now has a disease that she had to care for inside her loved one. She still loves the guy. She hates the disease.
Right.
Interesting. She loves the guy and hates the disease.
So she had to handle that. So how do I handle? It's like you love somebody and that somebody is being eaten by cancer. It's going to be short-lasting and the person, but this is not short-lasting. Do I not treat the disease and let the person die? No, this is somebody that you love. You won't do that. You want that person to live, but you want that person to have quality of life.
Right.
So when she saw the way I was treating her husband, she said, I want to be your patient too. And when we started talking, the main problem with her that struck me was the alcohol intake. She was really becoming an alcoholic. I said, we have to get you some help. So the husband, because he had a small infection, I said, I'm going to call a home health care agency to have a nurse at least come. But they come, once a week, twice a week, and they have to do what they have to do. They are not there to hit the water.
No, it's the infection, right?
Hit the water and make you some hot tea. Sometimes they do it, but it's not, if they say no, it's not their duty. They are not there for that. Or if you have to have the garbage taken out because you are overwhelmed with work, they're not there for that. So I say, at least I get you the nurse and, call this company, Senior Helping Senior, and try to talk to them. Because the way I always tell you is like a menu in a restaurant. You can pick and choose what you want, but you're going to invest on good quality of life for you and for your husband.
Dr. Mencia, you come from a family, foreign family, and they always did take care of their families, it seems like better.
Yes, yeah.
And my grandparents, they were from Hungary and all. And I remember they wouldn't need a personal assistant years ago. Everyone lived a block away. They lived in the house together, and it was
and we
grandma
had the
was there.
extended family.
Yeah, everyone was there,
Sure,
and so that's why maybe this is just a whole new mindset. The family's not here anymore, so we have to have another kind of a family, right?
And that's why I was so attached to my my mother-in-law, because when I first came here with my dream of opening a geriatric center, my daughter was only a month old. So grandma was the one that would stay at home and take care of Armine while mommy and daddy went out to work.
Mm-hmm.
And if it's not because of her, we probably would not have progressed as fast as we did. In 3 years of being here, I was in a small office, 1,300 square footage office. And it had 3 exam rooms. And I took one of the exam rooms and made it an operatory for Rosemary and left 2 exam rooms for me. So I was working on only 2 exam rooms. And that is hard for me because, I work and I, have my whole team together. We need more room to get the work done. But we did it. And because of grandma being there,
right,
taking care of Armine, we were able to take care of the business and make our dream. In 3 years, was building out the center that we have now in Fort Lauderdale. 3 years old being
But
here
now
for
let's
Lauderdale.
move that forward however many years. Now you're winding up taking care of Rosemary's mother. I mean, Rosemary's taking care of her mother. You're making sure everything
Right.
works right. So it's now it's the other thing that happens. It's always this.
It's that cycle of
It's
life.
always the cycle of life.
Right.
But a lot of people forget what you just said. They didn't remember that the mother or the grandmother was there to help them.
Absolutely.
And now
and
they're lost
when she
souls.
was deteriorating, I told Rosemary, I know you don't want her to go into a nursing home, so we're gonna get a house, so the mom can come in and live with us in a house. And when Daddy died, it was the same way. Daddy died at home, and we took care of Daddy, and that's what he wanted. He said, "Don't let me die in a hospital. Don't ever send me to a nursing home."
Well, and with that, I have to tell who you're listening to. You've been listening to Dr. Andy Mencia. Of course, we all know who he is, but I'm going to do this anyway. If you need any help today, he is there. He's on his way down to his Fort Lauderdale office. It's 954-489-1345. Don't wait until it's late. Just go down there now. 954-489-1345. It's a long weekend. If you don't feel well today, go there now because it's going to be very hard over the weekend. And then go to their website if you want to see more things they do. It's AGI for Adult Geriatric Institute, AGIFL.com. And for those of you now, you've been asking for them to have another office. They have one in Boynton Beach. It's not always open on Saturdays, but
They're open today.
Oh, you
They're
are
open the last show we
that's
did.
fabulous.
And they beat us because we finished around 2:00 and they were open until 4:00 in the
More
afternoon
people.
because they
Yeah.
have more people coming in. They had a lot of dental emergency people that wanted to get the work done on Saturday. So Mike will be there today.
amazing.
Yeah.
All right, the number there is 561-270-6494. Remember, it's AGI Medical and Dental Centers. You go on the web, you'll be able to see it right away. And I as a personal experience, Dr. Mencia is my physician, and it's just wonderful to have him and to. I'm running out of my vitamin D.
Vitamin D.
I mean, because you do. That's the other thing about you. You really do look at the whole person.
Absolutely,
And,
and do a incorporate traditional with holistic medicine. You have to incorporate it, and in that sense, I can say I had been sort of ahead of the curve because a lot of physicians up to today they say no, I either do holistic or I do traditional, and one would not believe on the other, and I think there is they both bring a lot. And growing up in Hawaii with my mother, if I was sick, she would go in the backyard, grab a couple of leaves, she would wash them, boil them, make a tea, and you drink that and you feel like $1 million. So, we grew up with that. So I still remember that everything doesn't have to come in a pill.
And it's funny because they now sell coconut water, right? Well, I remember when I grew up in Miami, we got the coconuts, we sliced them
Slice
open
with
somebody,
a straw.
right?
With a straw.
And then with their little holes, we drink the water, we'd eat the coconut. Mm-hmm. And now, of course, everyone lost that, and now it's coming back. But coconut water has a lot of sugar in it.
It's a
when
lot
you
of
buy
sugar.
it.
So whenever you try to process something that is not the way it comes from nature, you're going to alter what you're doing. So whatever you can get. And I was talking to one of my patients. She's one of the few 9/11 survivors from the emergency service that went first in when the tower came down. And, she's doing so well. And we were talking about hydrating her. And her significant other is a nurse. So I say, we can do IV hydration, but if you ask me what is best for you is oral hydration. And the nurse looked at me. I say, what? It takes longer to hydrate, but it's Mother Nature. When you want to hydrate, Jim just drank his water. When you want to hydrate, you drink. And the body will be able to process what it needs and discard what is in excess.
Okay, and with that, we have run out of time, unfortunately. Dr. Mencia will be one of our distinguished speakers at our Cure Symposium coming up in October. We'll talk about that more. But thank you, Dr. Mencia.
Oh, we block, right?
Okay.
We block October for the symposium. Ina is going to make sure.
That's right. You got to go to Dr. Mencia's, please. That's 954-489-1345. If you're not feeling a little bit, if you're not perfect, go down there today. Thank you, Dr. Mencia.
Thank you. Thank you, Jim.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.